hearing from our panelists, because both Antonio, who's with us today, is a graduate of Master of Science graduate of the School of Public Health in ergonomics, and he's generously given us his time to be here tonight to help you think about your future as a public health professional, what it's like to come to Boston, what it's like to survive winter in Boston, but more importantly, what it's like to study at Harvard and what that educational experience can do for you and what it can do for the future of your career, as well as for those lives that you will touch with the education that you're able to get at Harvard. So I'll begin right now, and when Santiago gets here, we'll introduce you to Santiago. I don't have a remote control, so I'm going to have to stand over here by the computer. Sure, that would be terrific. Thank you so much. So the Harvard T.H. Chan School of Public Health is one of 11 graduate schools within Harvard University. We are located in Boston, across the river from Cambridge, which is the famous buildings that you've all seen on campus. Ours are not quite so pretty. Some 1960s buildings that were built near the Longwood Medical Area, it's called. So we are right next door to the Harvard Medical School, and just a block down the street from some of the best hospitals in the world. Dana-Farber Cancer Institute, the Brigham and Women's Hospital, and so on and so forth. And one of the benefits of that intensive medical and scientific community is that our faculty members are researchers and practicing physicians at some of those the best hospitals in the world, and you as students also have access to internships, placements, research opportunities as well at those institutions. We also partner with Massachusetts General Hospital, which is another one of our teaching hospitals, and again, one of the greatest hospitals in the world. Next slide, please. The mission of the School of Harvard T.H. Chan School of Public Health is to advance the public's health through learning, discovery, and communication. That's our official mission statement. But I would add to that, it's not only learning through discovery and communication, but it's actually translating the learning and communication into policy and action to improve the lives of millions of people at a time. Next slide, please. When I took this job at Harvard about 8 years ago, my mother was very excited that I was working at Harvard Medical School. And I had to say, sorry, Mom, I'm not working at Harvard Medical School. I'm working at the school next door, which is the School of Public Health. And she said, that's great, sweetheart. I don't know what that means. So one of the things, not for my mom in particular, but I sent her to this webpage, and I said, Mom, we have this great webpage that talks about what's the difference between medicine and public health. So without going into this too much, and you can see at the bottom of our slide here, there's a hyperlink, and I will share these slides with you all later so that you have access to all of the information so you don't feel like you need to take pictures of my slide deck, okay? Public health focuses on populations, and medicine focuses on the individual. So if I'm any physicians here? Any folks studying to be physicians? Okay. So if you're a physician, primarily you're focused on the individual patient. I'm the doctor, you're the patient, you come to me with a problem or a preventive problem. I look at your situation and I have an intervention with you, or I talk with you about solutions or to disease interventions. If I'm a public health professional, I look at this entire room, in fact, this entire building, this entire city, this entire country, and I say, what are the influences that are affecting the health outcomes or the possibilities for the highest attainable standard of health of this entire population? So we look at what are the culture, what are the economic situations, what are the food sources, what's the environment like, and what are the political pressures, and what are all of these systems having to do with this large group of people, so that at the end of the day we can try to improve the lives of large sets of populations at a single time. That's not to say that one discipline is better than the other; they just have different approaches. Moving down this chart, and I'll go rather quickly, but the public service ethic is actually palpable when you come to the Harvard School of Public Health. It is, of course, within the context of the concern for the individual, because individuals, of course, make up groups. And if we're interested in improving the lives of groups, we are, by definition, interested in improving the lives of individuals. Versus medicine, which has, of course, an individual service ethic. I am the physician, I'm going to uphold the highest standards I can, and I'm going to help you individually to the best I can. Of course, on the flip side, within the context of social responsibility. Both disciplines, thankfully, are now focused on disease prevention. I would say that medicine in the past largely was focused on diagnosis and treatment, which was way too far down in the game, while public health was focused largely on prevention. I'm glad to say that both are focused now on disease prevention. The difference is I'm focused on disease prevention as a physician with you, the individual. Of course, as a public health, I'm looking at the whole community. Lines of specialization is the last thing I'm just going to go over. So for example, in public health, we're organized along analytical methods, whether it's epidemiology or toxicology. What's the setting and population? Is it occupational health? Is it global health? And we look at substantive health problems, big problems, nutrition, environmental health. By contrast, lines of specialization in medicine are organized along organ systems. Am I a cardiologist? Am I a nephrologist? Am I a pulmonary specialist? What's the patient group? Obstetrics, pediatrics, so on and so forth. And what's the etiology or pathophysiology, whether it's infectious disease, oncology, so on and so forth. Okay, next slide. There's a lot more on that webpage if you want to dive more deeply into it, but I just wanted to give you a quick sense of the two disciplines. They clearly interact, and probably 40 to 45% of our graduates are physicians. And the reason they came to the School of Public Health is because they wanted to add a more global or population-based perspective to their clinical practice. Our objectives and core values. The objectives, of course, are highest level of education, fostering new discoveries, but the reason I put this slide up here is because I wanted to underline our core values. It's very much a mission-driven school. And so much mission-driven that on the side of our building in granite is etched in about 12 different languages the World Health Organization's motto, which is that health is a fundamental right of every human being. So every morning as you come to campus, you walk by it in Arabic and French and German and Hindi, and of course English.
Mexican.
Spanish.
Mexican.
And Mexican, yes. Okay, next slide. Harvard Chan approaches public health from multiple directions, and we developed this little Venn diagram to show you that none of these disciplines are separate, they're not siloed, they of course intersect. Population science is basically the bedrock, forward, is the bedrock of all public health disciplines. So all of our students have to understand epidemiology, biostatistics, and sort of ancillary things like nutrition, global health, environmental health, bioinformatics. But we also have a very, very deep and perhaps one of the best schools of public health dealing in the biological sciences. So next slide. These include immunology, molecular biology, genetics. We have many, many scientists working at the level of the molecule or the gene, trying to understand what is affecting public health from the very, very most root basic set of science. When you put those two things together, of course, discovery science is really great, the information is fantastic, but if you don't actually turn it into our next step, which is policy and social sciences, you don't actually get anywhere. So you have to take the discovery, you have to take the learning, you have to take the understanding of statistics and the molecular level and actually turn it into policy and behavior change for large groups of people if we're ever going to affect the health outcomes for people around the globe. So at this point, I'm going to stop. Actually, I'll do this slide, and then I'll ask Antonio to talk a little bit about his personal experience at the school. The makeup of the school right now, we have about, over there on the right-hand side, you can see we have about 1,140 students in master's and doctoral programs. I'll just make a footnote over here for any of you who are post-PhD work. We have about another 300 postdoctoral fellows who are also continuing their training in the postdoctoral fellowship research stage of their career. By degree program, we have 35% at the doctoral level, about 45% in the Master of Public Health, and then 20% in the Master of Science. So fully 65% of our students are master students. Excuse me. For those of you coming from other countries to think about studying in the United States, about 40% of our students are international, with more than 60 countries at any given time represented. Last year at commencement, we graduated students from 66 different countries, and I will tell you that our alumni then continue to spread out around the globe, and when I last checked about a year ago, our alumni reported living and working in more than 125 different countries around the globe. So it's truly a global focus, a global network of practicing public health professionals. I'll come back to that later because it's actually one of the things that makes the School of Public Health a truly unique educational environment. For those of you who are interested in the gender breakdown, we are 60% female and 40% male, and 70% U.S. underrepresented minorities. The female ratio to male continues to increase on a slow but steady pace. So it's clear that the future of public health is increasingly in the hands of our female students and graduates. So at this point, forgive me, I'm getting over a little cold, so apologize. And in that regard, I'm going to let Antonio talk for a few minutes. And I'm going to ask him to tell you a little bit about why he came to the school, what his experience was like, and I think it's also important to understand what that experience can do for you in opening doors, opening your eyes to possibilities, and opening career possibilities for you as well. You may feel free to speak in English or Spanish as you feel comfortable.
They need to get used to the English.
Yeah, you do have to study in English at Harvard, so.
Yeah,
okay.
pretty much. So, thank you very much,
Sure.
Jim. Hello, guys. Hola. So, I'm going to tell you a little bit about my own experience at Harvard. I graduated across the street from the Ibero as a biomedical engineer. Then I went to Harvard as a research fellow, which is the kind of the appointment I got there. And I did research for about 3 years in environmental health. And then during those 3 years, my idea was getting the master's degree in environmental health, which was more like my idea. But then when I was there, I was also taking some classes and courses about different things. And then I got this course of ergonomics, which is all the musculoskeletal problems and also stress problems, blah, blah. So I really fell in love with that idea. And then after 3 years, or pretty much 2 years of being in Boston, I tried to get into the master's degree, which I got it. And then I started the master's degree in ergonomics. I was second student in that master's. And then we was just so wonderful because of the environment, how they make you study, but also how you get into the program, as Jim was saying, with and the experience that you get, all the experience around the world that focus you in one thing. And I remember the first day in my master's. By the way, I got in the master's degree. We began classes in September 12th of 2001, which was one day after the 9/11, and it was so bad that day. I remember because they always throw a huge party for the new students. But that wasn't that. So we just got into the school. I went to the classroom and started to learn. But I remember one day before we got all the material for the first class, and it was just like this big, and all the papers that you have to read for the first class. Of course, there are some students that don't want to read. There are some others that really want to read, and it was very challenging those first weeks of the class. And I went through the first year, and then in the second year, I have the opportunity to go to Sweden for my third semester. And then I was the first student in that program that I was going overseas to develop a project. So my third semester was in Sweden, and we went around the country developing a very nice project for call centers and ergonomics problems, musculoskeletal problems, etc. So I spent 6 months in Sweden, which was the winter time, by the way. It was so cold, but anyways, we made it. And
Sweden is even colder than Boston.
Yeah, much colder. 23 minus degrees or something like that. And then anyways, and after that third semester, I went back to Boston and I finished the master's degree, and then I came back to Mexico, and then here I got another master's degree and PhD at the Anáhuac University, at the Anáhuac University. But what I want to tell you is I think there are different ways to get it at Harvard, the School of Public Health. I went because I wanted to do some research, and then my second step was getting the master's degree. So I'm saying this because not only the guys who get A's or 10s here can get into Harvard. I think the one can get into Harvard is the one that wants to get into Harvard. Because no matter what are your scores, it means how much you want to be at Harvard. And once you are in there, it's just you have to enjoy it, and you have to focus on whatever you want to do for your country. That's what my idea at the end, I guess. Coming back to Mexico and then be in charge of any institution that provides medical attention or so. As soon as I got back, I got invited to be in charge of all the administrative stuff for around 100, 108 hospitals. This institution is a MIM in the state of Mexico, which is more like ISTE or IMSS for the country. And then now I am in charge, I'm the CFO of Seguro Popular in the entire country, which provides medical attention for 55 million Mexicans, and our budget is something 78,000 million pesos every year. But what is nice about this is that I not only have the point of view of my own country, I can share whatever I learned at Harvard, because then you get all the experience for many people that from different parts of the world, and everybody is doing different things. But I guess all those experiences are making this country richer and richer in many public policies. I think I stop there, and then we can go with something else.
Great. Okay, we'll take the next slide, please. Thank you, Antonio.
Yep.
This slide talks a little bit about building on what Antonio said. One of the things that's truly unique about the School of Public Health at Harvard. And there's one item that's not on the slide that in the course of my presentations over the last 2 days I've decided to add. And that is that I want to remind you that the School of Public Health is one of 11 graduate schools within what we like to think is the greatest university in the world. You may argue that point, but it's still a pretty great place. And one of the things that allows you to access is the incredible breadth of not only the students at our school, but the other thousands of students at many other schools. You're also able to cross-register, meaning you can take classes at the business school, the Kennedy School of Government, the law school, the engineering school. Let's say you're a cholera person and you want to think about not only the epidemiology of cholera, but you want to think about sanitation and health systems, which requires engineering. Essentially, whether engineering revolves around digging a latrine pit, or whether it's actually building safer health water delivery systems on a grand scale in a country. So you have the options to access all of those courses. In addition to all of the rest of the opportunities at Harvard, you can also register at MIT, the Massachusetts Institute of Technology, which may in fact be the greatest technological institute in the world, which is happily situated a half a mile between Harvard's two campuses and on our shuttle bus route. So you can also take courses at MIT. And we often have students who collaborate in projects. For example, students a few years ago were working on a telemedicine project using cell phones to deliver healthcare diagnoses and so on in rural Africa. And they partnered with folks from the MIT Media Lab who actually had the expertise in bringing that kind of idea to bear, but our students had the expertise in actually how to provide medical diagnosis in a resource-poor setting. So that's just an example of the kind of change ideas that can occur when you enroll at Harvard and have access to this incredible wealth of information. Were you able to take classes at any of the other schools? I know when you went there, our university was not all on one schedule. It was more difficult. Some of the schools had different semesters. We fixed that so that every place at Harvard starts and ends at the same time so that you can take classes at different schools. But
I went to the Faculty of Arts and Science. I took
Okay.
one class over there.
and took some classes over
Yeah.
there. So it was more difficult when he went there than it is now. Happily. I mean, happily for you. Not happily for you. But I will say that it was alumni who complained about that problem and said, you really need to fix this because we want to take advantage of these incredible resources. Under Julio Frank, anybody know Julio, who was the Minister of Health in Mexico?
And he
Obviously-
invented Seguro Popular.
He
was
did.
the creator.
He was the creator. You could talk a little bit about that if you would like.
About Julio Franco, about Seguro
Sure,
Popular.
and then he became the dean of our school for 6 years and just left.
Yeah, well, he was
recently.
Minister of Health, as you all guys know, and with President Fox, if I'm not
Yeah, Vicente.
And he was the creator of Seguro Popular, which now, as I was saying, provides medical attention for 55 million Mexicans, which is pretty much half of the population in this country. And then he was the greatest, I guess, researchers and ministers of health ever in this country. And he then went to Harvard, and he was the dean of the School of Public Health for 7 years or so.
6.
6 years. And then now he's the president of the
University
of Miami. And,
Yeah.
he's still there.
And I will say one of the things that was great about Julio's tenure at the School of Public Health, he started almost at the exact same time I did, so we got to know each other very early on, is that he brought that ethos of health systems development to the school and really changed the school from a place that was so focused on science and research into one that had that Venn diagram that I developed, which is increasingly focused on policy, practice, and implementation at the local, state, federal, and international level. And I have to say that Julio pushed that agenda very strongly forward, bringing with him the expertise that he brought from his experience in Mexico, as well as his experience at the Gates Foundation and the World Health Organization.
Question?
Yes, absolutely.
Was he in Harvard before or after being Minister of?
After.
Oh.
Yes. So
He recently, 1 year, last September, he became the president of
Yes.
University of Florida. But 6 years before that, he was at Harvard, as dean of the School of Public Health.
That's right. Our new dean is terrific too. I can talk to you about her. She's on the cover of the magazine you have there as well. Michelle Williams, a 2-time graduate of our school. One of the things Julio instituted was the Division of Policy Translation and Leadership Development, which was to bring this idea of the greatest world leaders coming to the school and thinking with our students about changing health systems around the globe. So through that program, he brings world leaders as visiting fellows, ministers of health, elected officials, communications people, people who work, are journalists. Just last week, I had an example that I'll tell you. I was sitting in the cafeteria having lunch, and I turned to the gentleman next to me, and we started chatting, and it turns out his name is Dr. Mohamed Pate. He's the former Minister of Health of Nigeria, who just happens to be at the school for 3 months as a visiting fellow. We had an incredibly enriching conversation about Nigeria's burgeoning or re-burgeoning polio epidemic when it had largely been eradicated in that country, all the while trying to meet the Millennium Development Goals that are set sort of at the world stage by the World Health Organization. I would just give you that example because it sounds like, wow, that's amazing, but that could happen any Wednesday afternoon that you happen to sit in the cafeteria. But it isn't just world leaders, it's the other students who also come to the school with lots and lots of experience from around the globe, having worked at many NGOs, at Doctors Without Borders, or so you have to say Médecins Sans Frontières. And how do you say it in Spanish? Thank you, okay. Or Oxfam, or UNICEF, or the World Health Organization, or you name it. So it's an incredibly rich place. Also, our research projects span the globe. As a student, you may find yourself working on HIV surveillance in Botswana, or trying to reduce maternal and infant mortality in India, or working on nutrition projects as China's economy and their middle class develops. They're also starting to see some of the more developed world problems of obesity, diabetes, chronic disease, cancer, due to overeating and things like that. So any of those projects are just 3 examples where you might find yourself, of course you might find yourself back here in Mexico working on a project as well. Anything you'd like to add to any of those comments?
No, I think I'll be ready for some questions.
Okay.
I mean, it's up to you.
Okay.
Your agenda.
Next. I'm going to run very quickly through our disease programs, through our degree programs. This matrix just sort of shows you how we divide our programs philosophically. So both on the horizontal, we have master's and doctoral degrees. We don't have any undergraduates at our school. And they're divided on the vertical into, on the left, professional or practice degrees. Those are the MPH, our Masters of Healthcare Management. I only mention that because it's a mid-career physician executive program. So 20 or 30 years, you may decide to come back and if you're running a hospital or a health insurance organization and add some management skills to your portfolio. Or the Doctor of Public Health degree, which is a doctoral practice-based degree. I'll talk more about that later. On the research side, we have a Master of Science degree, which is a 1 or 2 year program, or the PhD program, which is a 5-year program. Next, please. This is where it gets complicated. So I'm going to go over these rather quickly. There's a sheet in front of you, this little half sheet, which basically mirrors the information that's going to be on the next few slides. If any of you wants more information about any of the degree programs, please fill this out, and please pay special attention to make sure that we can read your email address. And somebody from our admissions office will get back to you about whatever programs you check off on this box and reach out to you with more information, okay? So think about that as I go through the next 3 slides. Master of Public Health is our core program. It comes in 2 versions, a 1-year program and a 1.5-year program. Over on the right, you can see the areas of focus on the lower right over there: biostatistics, epidemiology, environmental health, global health, management, policy, health and social behavior, and quantitative methods. The difference between the 1-year program, which is essentially start in August, graduate in May, and the 1.5-year program, start in August, study through May, spend 3 months in the summer on a field placement anywhere in the world that you can work out with your practice preceptor or your practice faculty, and then come back for another semester, graduate the following December. The difference is the prerequisites to get into the program. The 1-year program requires that you have a prior graduate degree. You can see a list of the kinds of graduate degrees, whether you're a doctor, a dentist, a PhD, a lawyer, have an MBA, or you must have a bachelor's degree, which in the US is a 4-year degree, plus at least 5 years of relevant work experience. And I stress relevant. So that means you've done something that is actually pertinent to the career track that you want to take in the future, or that has at least given you an underpinning for the studies that you're going to undertake at the School of Public Health. The 1.5-year program is for those who have less experience. So you don't have to have an advanced degree, but you do need to have a bachelor's degree and at least 2 years of relevant work experience. And as I mentioned, you graduate 16 months after beginning the program. On the right-hand side at the master's level, the right-hand side of that diagram I just showed you are the research-based master's degrees. And just like the MPH program, these come in 1-year and 2-year versions. Again, it's based on the prerequisites. The 1-year program of Master of Science candidates, they're either established researchers and investigators with prior work experience, and you must already hold a master's or prior doctoral degree. You can see the specializations there. The 2-year Master of Science, you only need to have a bachelor's degree and some relevant work experience. Again, that's the difference, right? You spend an extra year training since you haven't brought as much experience to the school in the first place. Over on the right, a new program that's just coming out in the fall. I'm not going to talk much about it because it literally was announced 2 weeks ago. So basically what I know about it is what's on the screen. It's a Master of Science in Health Data Science, and if anybody's interested in that, I will be more than happy to give you the email address of the person who's administering that program, who can answer all of your questions about what that program is going to look like. Okay? On our doctoral degree programs, again, we have on the left side a practice degree, and on the right side a number of research-based degrees. On the left side, the DRPH, the Doctor of Public Health, is a comprehensive, interdisciplinary, and I underscore 3 times, leadership development program. It's a 3-year program that's designed for individuals who want to go run organizations, NGOs, health systems, et cetera, et cetera. What's unique about this program is it's a very small cohort. We will out of the classroom and in practice settings. So your first semester, you might spend a 3-week placement, and the following summer you spend 3 months, and then your second year you spend part of your spring semester, and then your third year is completely in the field. So you spent your first 2 years developing what essentially is a thesis project. And instead of writing a thesis like most PhDs do, and then you stand up and you defend your dissertation, you actually go out into the field, develop a project you want to work on, and you execute that project, and that is in fact your thesis at the end of the third year. The Doctor of Philosophy is a much more traditional program. 5 years, typically. It can sometimes be 4, sometimes 6, depending on how the program unfolds for you. These are scientific, technical degrees, research-based degrees. You have to have a strong background in mathematics, statistics, quantitative methods. You need to have some relevant work experience or prior graduate work in their area of study. So we don't really accept students coming straight out of a bachelor's degree. You need to have a little bit of prior work experience, 1 or 2 years under your belt before we'll accept you into the PhD program. You can see the areas of focus from biostatistics to the biological sciences. Those are our bench scientists working on the genome at the molecular level, doing stem cell research on malaria eradication, so on and so forth. But also health policy, population health sciences, which has 5 different versions of which you can see on our website. Currently, we have about 185 students in our PhD programs. Next slide, please. I'll mention briefly we have a few joint degrees with other schools, both within Harvard and without Harvard. On the left side are the degrees we offer within Harvard. The first one is a brand new degree that I'm very excited about. Anybody interested in urban planning or architecture? We have some friends across the hallway from the Graduate School of Design in the next room. It's a Master's of Urban Planning and a Master of Public Health. And I'll just mention that it's for those who are interested in designing healthy cities. So I think Mexico City could use, like pretty much any modern city, could use some folks focusing on this, whether it's transportation or environmental issues or you name it. I'll just mention you have to apply to both the Graduate School of Design and the School of Public Health. You have to be accepted at both schools, and it's a 3-year program. 1 year at our school, 1 year at their school, 3rd year combination of the 2 programs. We also offer a joint law degree and Masters of Public Health degree with the Harvard Law School. On the right, if you're interested in nursing, you can get a Master of Science in Nursing at our sister college just across the park from us at Simmons College. And you can also, I'm going to skip the last one because you have to be enrolled in a U.S. accredited medical school, which I don't think applies to anybody in this room. Any questions about our degree programs before I go into the admissions process, which I think, in my understanding of doing this for a couple of years now, is quite different than applying for school, graduate school in Mexico. Any quick questions about degree programs? Okay, there'll be plenty of time at the end for questions. When you apply to the School of Public Health, you need to apply through something called SOFAS. And this applies to our master's degrees, the MPH, the Master of Science degree, and the Doctor of Public Health degree. It does not apply to the PhD program, so hold that aside for the moment. You have to apply through SOFAS, which stands for Schools of Public Health Application System. It's a centralized system to apply to any school, accredited school of public health in the United States or Canada. The deadline for submissions is December 1st each year. And I'm going to point all the way to the last bullet on the bottom, which is that SOFAS charges a $135 application fee. Depending on which schools you then apply to within the SOFAS system, you may pay an additional fee. At Harvard, we don't charge an additional fee. That's SOFAS's fee, not ours. There's no additional fee to apply to the School of Public Health. The online applications include a number of things. Of course, your transcripts, not your high school transcripts, but anything you've done since high school, your undergraduate, your graduate work. And you have to submit those both in their original language, so the original documents. You must also submit them in English, and you have to upload them to WES, the World Education Service. And what WES does is takes your, for us, international degree and translates it into a US equivalency so that we can actually see that you have met the US equivalency requirements for admission.
That takes a little bit of time. So if you're going to apply, I'm going to suggest that given it's October, you're not going to make it for December, so we're talking about next year. You want to give that process a few months to make sure that that actually gets done in time. You also have to take standardized tests. Anybody know what the GRE is? Okay, so I don't want you to run terrified from the room about the GRE, but I also want you to have a healthy respect for the GRE. It's a difficult test. It has 3 components. 2 of them are English language components. One is a quantitative English language skill set. The other one is an analytical English, which means you have to write an essay. All of these are time-based, which makes it that much more frightening. And then the other section is the math section. For some of you may not have done math like this since high school, or at least since early college, calculus, algebra, and so on and so forth. People frequently say, what's the minimum GRE score? There isn't one. And the reason there isn't one is because we have multi-disciplines that have different requirements. It's also because we have a holistic application process. In other words, the GRE scores are one component of a 5-component application system, and we like to look at the individual in their entirety. That's not to say that some degree programs, if you're a quantitative methods or a biostatistics major, you can bet that they're going to want to see better math scores than if you're a health policy person, right? But if you're a health policy person, they're going to want to see that you have a really good grasp of English so that you can sit in a classroom with people from around the world and have healthy debates in English and hold your own. The math skills are still important. You still have to pass biostatistics and epidemiology, but it may be way less in those disciplines than in some other places. I hope that makes sense. You need 3 letters of recommendation. And from what I understand about the Mexican system is, and you may feel free to jump in here, is that it's typical to find the most impressive title of the person you can for a letter of recommendation. Harvard is more interested in what the relationship is of the person to you. Now sure, it's great if that person is one of your professors or a senior professor in your department, but if they haven't worked directly with you, that letter of recommendation isn't going to get you very far. So you want to make sure that it's somebody who knows you, knows your skills, knows your personality, knows what you can accomplish, and knows what your future possibilities are, specifically. Do you want to say anything about that?
Well, yeah, that's why my first idea to go to Harvard first, and doing all this research in environmental health helped me a lot to get the recommendation letters, because I got actually 4 letters of recommendation. 3 were from professors or teachers at the School of Public Health. The 4th one was my boss here, my last boss here in Mexico, which I really dropped that letter because it said, well, Antonio Chemon is a very nice guy, very hard worker, and that will be it. So, I mean, you need more than that. So, at the end, I hand out those 3 letters of recommendation who really helped me to get into the program.
Yeah, and we have a network of alumni, Mexican alumni here, who actually both understand the Mexican culture as well as the Harvard culture. And typically, alumni will be helpful to you. You can reach out either through the Fundación or through me to connect with folks who can actually help you look at those letters of recommendation, as well as the next item, which is the statement of purpose and objectives. This is the point where you get to talk about yourself. And it's incredibly important at Harvard, because Harvard sees itself as training leaders and change agents for the next generation of public health. So what we want to know is that you see yourself as a potential leader, as a potential person who wants to go out and change the world. How are you going to do that? You need to think long and hard about exactly why you want to come to Harvard, beyond, wouldn't it be nice to go to the United States and get a graduate degree from Harvard? That would make my mom really proud. You want to do something like, I'm going to give you 2 examples. A student I heard last week speaking in front of a panel of potential employers. He was a biology undergraduate major. He got his bachelor's degree in biology and had a lot of student debt. It's very typical in the United States. So he joined Teach for America, which is a program that hires young college graduates to go into resource-poor settings, either rural settings or urban settings, and become school teachers. So he became a science teacher in the south side of Chicago. Anybody familiar with the south side of Chicago? The south side of Chicago is probably the most violent urban setting in the United States right now. There's been more than 1,000 murders in Chicago since the beginning of this year. It's on pace to eclipse anything you can imagine. Paul taught for 3 years in Chicago and realized that it was almost impossible for him to do his job because the trauma of the violent environment that these kids were living in was traumatizing their families, it was traumatizing the kids. And so he wrote a statement of purpose that said he wanted to come to the School of Public Health and enroll in a 2-year Master of Science program. Now mind you, he didn't want to come be a policy person and go work in government. What he said was, I want to come gain quantitative skills because I've decided that gun violence is actually an infectious disease. And I think we can take traditional methods of stopping any disease that spreads through a community and apply the quantitative methods to that and stop dealing with it as a law enforcement issue, but think about it as a systemic, cultural, infectious problem in these communities. Quite a novel approach. So he's at the school now getting his quantitative skill set in line and is developing a project that he's going to work on in his 2nd year that's going to help him think about what is the epidemiology of gun violence in Chicago and how can he begin to use that to change the dialogue within that community, within the policymakers, and so on and so forth. The other person I'll mention who is already a pediatrician in Nigeria, his name is Osagi Eseboye. And Osagi was a pediatrician dealing with obviously young kids, lost 2 children in very rapid succession, and was incredibly frustrated. Not because he was frustrated that he was a bad doctor, but because he decided that he did everything he could with the system that he was working within. But it was the system that had failed these kids. It made it impossible for him to save their lives. No matter how good of a physician he was, he couldn't have done it. So he wrote an application saying, I want to come study health management at the School of Public Health because I want to go back to Nigeria and I want to fix the healthcare delivery system. And I can't do that unless I have the tools and the skill set to understand how health systems work, because right now I'm just a doctor. I'm just sitting in the hospital and it's not working. I need a bigger picture. So those are 2 examples of the kinds of folks. They didn't know the answers to their question. All they knew was the question, right? So think about what's your question. What is the question you want to answer, and how do you think Harvard's going to help you explore finding an answer to that question? Okay. On that note, you need to have a resume and a CV. Your resume and your CV should not be 14 pages long. It should be 1 page. If you have to go to 2, okay, don't go to 3. If you go to 3, you've got too much stuff on there, get it down to 2. 1 is better. If you have trouble doing that, turn to some other alumni, turn to some other folks. They can help you work on that. English. Is everybody understanding me so far? That's good. You laughed. You have to pass TOEFL or IELTS. Again, there isn't a minimum. You want to make sure that your English skills are as good as possible. Again, certain math-based programs have a little more lenient policy than other more language-based skills, degree programs. And I already mentioned the SOPAS application. Anything else you want to add about making a strong application to Harvard?
Well, I think the 2 main points is what Jimmy was saying about the letters of recommendation. I strongly recommend that you have to have a very strong letters of recommendation because it's the way they see that you are capable to have a nice degree and that you're going to change the world or at least your country. And second, I think your statement, because that really says what you want to do after you get the degree. I think those 2, I mean, among all of the others, that they have to be a good standard. But I think those 2, from a point of view, are the main keys for the application.
And from my understanding, again, having sat for the last few days with Mexican alumni, is that it's perhaps one of the culturally most difficult aspects. Right. So that's why I keep underscoring this need for the personal statement and the letters of recommendation, because I think it's a little bit outside of what I understand the comfort zone of Mexican culture. You have to talk about yourself, which for some folks seems a little prideful, but it's necessary. So you can work on it, and there are folks who can help you work on that as well as our admissions officers. Our admissions officers aren't set up to make the process as difficult as possible for you. They're there to actually help you succeed and help you put together a good application.
Yeah, and also it might be that one of the most difficult things for me was at the beginning of the master's degree was getting into the essays or even the statement that we are used to as a Latin culture to go around and around and around, and at the end you get the point. So in the US it's more straight. You have to start, and there are some even courses that help you how to write a statement, and the introduction, and then just a little development, and then just go straight to the point. And because that's maybe how we are taught to do it, like it go around, and then as many more pages you write is better for us, and it's not the same in some other countries.
Good. Okay. Any questions about the application process? I mentioned earlier on to set aside the application process for the PhD. I think if you hit we've gone over this, so we'll skip this one. We'll go to the next one. Applicants for the Doctor of Philosophy. The components I mentioned, the CV, the statement of purpose, the GREs, your transcripts, all that stuff is exactly the same. The only difference is for the PhD program, because Harvard is Harvard and they have to have some administrative complexities to just about everything, the PhD program must apply through our sister school, the Graduate School of Arts and Sciences. Through some arcane technicality that I don't understand, the GSAS is the only school that can actually grant a PhD degree. So they have to accept the applications. They take the application, the exact same application process I described, minus the $135 fee, by the way. They send the applications over to us at the School of Public Health, to the various faculty in the departments. They review the applications. They send the successful ones back to the Graduate School of Arts and Sciences, who sends you a letter and says, congratulations, we want you to come to Harvard. So just don't be, it's a little convoluted, but I describe it sort of in a cartoonish way because it feels a little silly, but it is, you have to go over here to apply, to come back here, to go over here, to come back to the school to study. You actually study at the School of Public Health. 5 years at the School of Public Health, you hardly ever go over to Cambridge to see those folks over there. Okay, any questions about that little oddity? Okay. The deadlines there are December 1st, in most cases except for the one program in health policy, which for some reason I don't understand, is December 15th. Okay, next slide. Financial aid. I'm going to mention that the School of Public Health has our own financial aid office. It's woefully underfunded, can never meet all the needs, but nonetheless, I encourage you, please don't skip applying for financial aid from the School of Public Health. The deadlines are different. You apply for admission December 1st. We're not going to tell you whether you got into the school until sometime around starting February 15th to March 15th. That 30-day window is when we start sending out acceptance letters. Okay? So during that time period when you're sitting waiting nervously, am I going to get in? Am I going to get in? Even though you don't know, you need to fill out a financial aid form anyway. It has nothing to do with whether you get into the school. Your ability to pay is completely separate from whether or not you get into the school. What happens is the admissions folks send the applications to the faculty. The faculty say, we want these X number of students. You get the letter. Then we sit down with you, look at your financial aid forms, and figure out how can we get you to come to the school. What's the package we need to put together to make it possible for you? I will tell you there's not a lot of financial aid from our school, but being Mexicans, you have such a great advantage, and our good friend Patty from the Fundación is going to tell you all about the special options that are available to Mexican students studying at Harvard.
Okay, hola, como nos decía Jim, yo soy Patricia Real y soy la directora ejecutiva de la Fundación México Harvard. La fundación fue creada aproximadamente hace 27 años por un grupo de mexicanos que venían regresando de posgrado en Harvard, principalmente de la Escuela de Negocios, y decidieron que no querían que ningún mexicano que fuera aceptado a Harvard se quedara sin sus alternativas. Entonces, crearon esta fundación y nosotros damos dos tipos de apoyos. Uno es beca y el otro es préstamo, dependiendo de la escuela a la cual estamos visitando y el programa dentro de la escuela. pasamos. Ok, gracias. Este año el apoyo aproximado fue de $22,000 al año por estudiante. Este puede llegar a ser hasta un 5% más alto. Nosotros cada año evaluamos cuál es el apoyo estándar que vamos a dar de acuerdo a los costos que existen en la escuela, en las diferentes escuelas. Y bueno, como sabemos que nuestro apoyo es parcial, lo que les decimos a los estudiantes es: hagan una solicitud a todas las instituciones que hay en México que les podrían dar una beca, y todas esas que hemos encontrado nosotros, o las principales, las pueden encontrar en nuestro sitio y son las que están mencionadas ahí. Entonces, si se van a nuestro sitio, hay una parte donde viene el financiamiento y vienen otras fuentes de financiamiento, y es una hoja de cálculo de Excel que les va dando toda esta información. Pero básicamente les decimos, aparte de nosotros, pues apliquen a CONACYT, apliquen para Fulbright. Ahora, ojo, Fulbright es la única de todas que les pide que soliciten un año antes de que vayan a solicitar a su programa. Todas las demás les van a pedir la carta de aceptación para darles el financiamiento. Fulbright no. Entonces, para que lo tomen en cuenta, ¿en cuánto tiempo, no? Tienen que pedir. Si van a solicitar en 2 años a la Escuela de Salud Pública, un año antes tienen que pedir de estos 2 años el financiamiento para Fulbright. También, ¿alguien aquí es de la UNAM? ¿Sí? Ok. Bueno, la buena noticia es que tenemos un convenio con la UNAM en donde si eres egresado de la UNAM o estudiante de la UNAM, puedes recibir hasta $50,000 de beca, en este caso, para tu programa al año de maestría. Vienen $25,000 por parte de la fundación y $25,000 por parte de la UNAM. Entonces, como es para la Escuela de Salud Pública, en este caso, ambas partes son beca. Entonces, bueno, ahí pues ya les ayuda bastante. Y para los demás no se preocupen, porque constantemente estamos firmando nuevos acuerdos, y entonces quizá para cuando entren ya hay un acuerdo del cual se pueden beneficiar y recibir un apoyo adicional al que damos. Todos nuestros apoyos son con base a necesidad. Entonces, una vez que Harvard los acepta, nosotros les pedimos una copia de esa carta de aceptación y empezamos a trabajar con ustedes, evaluamos sus necesidades económicas, y con base en eso determinamos cuál es el apoyo que les vamos a otorgar. Entonces, bueno, si necesitan el dinero, lo van a poder obtener por parte de nosotros. ¿Okay? Ahora, aparte de estos que están mencionados aquí arriba, hay una institución crediticia dentro de Harvard que se llama el Harvard University Employees Credit Union, o allá conocido como HEBCU, que es básicamente como el banco de Harvard. Y esta institución les da dinero a los estudiantes que están ahí. De acuerdo al programa que están haciendo, es el monto máximo de crédito que pueden recibir. No estoy muy segura de cuál es para la Escuela de Salud Pública, pero eso se puede averiguar en el sitio. Y la ventaja es que siendo un estudiante internacional, igual te dan el crédito y no necesitas un aval en Estados Unidos que te firme. Entonces, muchos estudiantes lo utilizan como para el último cachito que les faltó, si es que les llegó a faltar algo, ¿no? Porque, bueno, obviamente los préstamos son en dólares. Entonces, lo que les sugerimos es soliciten a todas las fuentes de financiamiento, más vale que les sobre y al final declinen, ¿no? A que les falte, y ya que tengan, o sea, todas, entonces pues van eliminando, ¿no? Primero quédense con las becas, lo que es gratis, y de ahí, ¿no? La tasa de interés más baja, etcétera, y al final el monto menor, que sea con la tasa de interés más alta en el caso que se requiera. Pero la mayoría de los estudiantes, sobre todo en el área de salud pública, se pueden ir, pues gran parte del porcentaje de su financiamiento va en forma de beca. La página de la fundación es esa, www.fundacionharvard.org. Estamos grabando todas las sesiones, las vamos a subir a YouTube para que las puedan revisar ahí. Soy Pati Villarreal y mi correo es pvillarreal con @, fundacionharvard.org. Si no tienen que apuntar, se meten a la página y ahí me encuentran. Ahí nos pueden mandar un correo para cualquier duda, ¿ok? Entonces, lo más importante que quiero que se lleven es, 1, hay financiamiento. La gente que está aceptada a Harvard, nunca hemos visto un caso de que se quede sin ir por falta de financiamiento, ¿no? Entonces, olvídense de la parte económica y concéntrense en la solicitud. Y dos, pueden estar 100% seguros que Harvard no los va a aceptar si no solicitan. ¿Ok? Entonces soliciten. Y bueno, cualquier duda voy a estar afuera en el lobby por si quieren platicar conmigo. Con muchísimo gusto platicamos de cualquier. Gracias. Mi correo, sí. P Villarreal, sin espacios, P Villarreal, todo junto con doble R, arroba, sí, fundacionharvard.org. Ok, fundacionharvard.org. Sí,
Patty, there's 2 more slides, but I don't know if you
oh,
want to.
yes. A ver, ok. Bueno, ahí está otras fuentes de financiamiento. FIDEC, que es el programa de Banco de México, FUNED, que también te da préstamos entre 9 y 15 mil dólares. Hay unas becas del Banco Mundial que te dan hasta 35 mil dólares al año. Y, sí, estas que también aplican para la Escuela de Salud Pública, ¿no? Entonces la Fundación Brockman, the American Association of University Women, y esto es únicamente para mujeres, y PEO. ¿Qué les iba a decir? Toda esa información la pueden encontrar en nuestro sitio. Entonces, si ahorita no la apuntaron, pueden ir al sitio y bajarla. Y también, lo que es súper importante es si alguno de ustedes está solicitando a los doctorados de la Escuela de Salud Pública, que se me puso decirles, estos son 100%, reciben el financiamiento de 100%. O sea, no tienen que pagar un solo peso para irse a estudiar el doctorado a Harvard. ¿Ok? Ya sea el programa de PhD o el doctorado que él maneja aquí, también es financiado. Hay un acuerdo entre CONACYT, la fundación, y Harvard, a través del cual todo es una beca y les pagamos tanto la colegiatura como la manutención. ¿Okay? Entonces, por los que estén interesados en el doctorado y por los que están interesados en las maestrías, bueno, ya les platiqué. ¿Sale? Gracias.
I have 2 more slides left and then we'll open for questions. And while I do that, if you would pass this around and just check your name off, please. And then at the end, I will, once that ends up over here with my trusty assistant, what's your name?
Thank you, Rosario.
Rosario, thank you so much. And then we'll also I'll collect up at the end your, after the question answer period, your little forms if you would like some more information. Oh, there was one more. Patty, did you need to say anything about Laudex? Okay.
Que aparte es el más caro, entonces. Pero bueno, existe también la ODEX, que es una institución que les puede dar dinero.
One question, Patty. This sign-up sheet that's going. Do you have the Excel spreadsheet of the names that registered, so that I can send out the slides? Because you students are from all over the place, right? There's no one contact person here. I'm just wondering how to send my slide deck out.
So the question was, do I have the Excel sign-up?
Yeah, because that sign-up sheet has everybody's email address on it.
Yes.
So if I can get that, I can send everybody my slides.
Yes, of course.
Okay,
Yes.
great.
And if not, they can also email me, and I can send them to you as well.
Okay, yeah, but it'd be easier if I just.
Yes, definitely.
Okay, so when I get that list, the list that's going around, I'll send everybody a copy of the slides, okay? Last 2 slides. I oversee the Office for Alumni Affairs and Career Advancement. So one of the things that I'm responsible for is making sure that our students have the tools to figure out how to get the job placement that they want when they finish their studies at Harvard. So that's not to say we don't find you a job. That's your responsibility. What we do is we try to prepare you to have the tools necessary to find the kind of position that you want. You may have been able to understand from a few slides about the variety of degrees we offer that public health is not a linear path. Antonio got a degree in ergonomics and is now the chief financial officer for Seguro Popular. So the path can be a little zigzagging, as we say, in the United States, but it's also a very broad discipline. So what we try to do is to provide you with an understanding of the options. And one of the ways we do that is by engaging folks like Antonio. So we have a very robust program that involves prior students who are now alumni of the school. You guys use the word alumni in Spanish? What's the equivalent word?
Graduado.
Graduado?
Graduado.
Okay, so if I say alumni, it's graduado.
Yeah.
So I work with the graduados of the School of Public Health, but we involve them intimately in the career at the school on a daily basis. We have online resources, including job listings. We offer a lot of skill-based career explorations and specialty workshops, including we have an increased emphasis on self-reflection. Because public health is a very broad field, we want you to understand what are your motivating passions in life and what are your life balancing issues. Do you have kids? Do you have family? Are you able to relocate? Because you need to understand all of those things in order to be a successful professional. We have a lot of career fairs at Harvard Chan School. We had about 30 employers at the school last week from in research and consulting spheres. That was just one particular career fair we held. We also take students to Washington, D. and New York City because most of the NGOs that operate out of the United States, we call them nonprofit organizations, but things like the World Bank, the World Health Organization, USAID, so on and so forth, they all operate out of the northeast corridor of the United States between Boston, New York, and Washington, D.C. So we take students there for site visits hosted by, guess who, alumni, who work in all of those organizations because our alumni work in every one of those organizations, sometimes heading the organizations as well. You have a chance to hear from alumni about what it's like to work there and is that actually a career path that you want to explore for yourself. And of course we have individual one-on-one sessions. These are basically start off with 30-minute sessions with some of our trained career coaches. We have a bench scientist who works with our folks who are in the molecular and biological sciences. We have a practicing public health professional who has 10 years of experience in the social and behavioral sciences. And we also have a director of our career services department who has more than 25 years of career coaching experience. So we have a really robust set of skills that set you up to help find that next thing that you want to do, to take that education and turn it into your next career step. All right, I think the last slide, this is just where do our graduates work. The short answer is everywhere. You cannot think of a country on the face of this planet where you will not find a Harvard Chan graduate. These are just a few of the top places where our class of 2014, which is the most recent data we have, actually I can update this with 2015, but it looks exactly the same. And I mentioned earlier that our alumni work and practice in more than 125 countries across the globe. And the last slide, Rosario, gracias. Is just the contact information for our admissions office. Again, the master's programs, both MPH and Master of Science, as well as the Doctor of Public Health apply through our school and that SOFAS system. Our folks at admissions are very helpful. They'll answer any questions you have. PhD programs, you want to talk to our good friends over at the Graduate School of Arts and Sciences, and that is their email address. I'll open the floor for questions for me, for Antonio. We'll try to answer anything we can. If we don't know the answer, I'll try to find the person at the school who can answer the question for you. Thank you. Anyone? Don't be shy.
I have a question, but it's a very particular question. I would like to talk with someone who can help me to know if what I have decided to do is what I need to do. Because I have been in like a pathway, as you said. I have so many steps in my education. Now I don't know what to do exactly because I have been working on behalf of the fetuses. So I came back from my last period in London for 4 years. I've been trying to help here in Mexico. I've been knocking all the doors, all the possible doors, and at the end, I can't, because I realize or I think that I need something more in order to offer more. And I think that the doctor in public health is the answer. But now that I'm listening, I'm not sure, because how it is so open or so big that I'm not completely sure if that is the way I should follow.
Give any advice?
Sure. I think the best advice I could give is get some interviews. maybe first go into the webpage or the School of Public Health, now Chan, but get to know all the programs. And then I think de la vista nace el amor. So then from there, but I think the best idea is to get some interviews with the people at Harvard. So you might want to go a couple of months, 1 month, 2 weeks, whatever, 1 week. I did that. I realized that I wanted to do some different things, ergonomics or environmental health. So I went to talk to the professors there, the heads of the program. So talking to them, I really realized what I wanted to do, and I decided to go with ergonomics.
I would say that that's actually a good piece of advice. And without sounding negative, I would caution you to do your homework first. Research the program, research the faculty's area of research, which every one of our faculty has a lengthy page talking about their research or their area of public health practice. And make sure that when you reach out to somebody, you have a specific set of questions that you want to discuss with them. Is that fair enough?
Yes.
Because I think you just want to be focused about your questions. And it may be, here's my set of skills. I looked at what you do. It seems like maybe there's some way I could move in this path. What do you think about that? But make sure that you go to them and say, I understand what you do. I understand your program. I understand your research. And I'm calling on you specifically because I think you may be able to provide me for some advice. Okay? Anybody else?
Kind of a personal question.
Personal question.
Specific moment you decided to apply for Harvard, and
So-
which moment you decided to return to the country and work with the Mexican government?
That's a personal question. Mira, la verdad es que siempre me quisiera a una universidad muy importante. Estoy en la Ibero y realmente me quería ir al Imperial College en Londres. Pero hice eso, empecé a investigar universidades que más o menos se empataran con lo que yo quería hacer. Y bueno, ¿quién no se quiere a Harvard? You say that it might be not the best university in the world, but it's the most famous. There is no question about it. And it's going to be the most famous for the next 100 years, right? So
You're fired. I'm sorry, I'm just kidding.
but
Sorry, I had to do one Donald Trump joke.
but it's true.
I
mean,
won't do any jokes about the wall, I promise.
but it is, for me, it was the best university.
Good, thank you, thank you.
But I'm saying this because I guess it's not the university where it makes the best student, as we all know. It's the best student what makes a very good university.
That's right.
So I think Harvard, what it has, and it has a lot, is the sharing of the people for the entire world. For my degree, when I got into the program, applied something like 100 people, and we got into only 2 people, only 2 guys got into that program that year. And but I enjoyed it so much, and I think when I finished the program, I was invited to stay for another master's degree and for the PhD, but I was already 32 years old, and I decided, I don't know if I was right or wrong, but anyway, I decided to come back to Mexico, and then I got here on the master's degree and the PhD at the end. But I never regret that, because I think I have done so much here in this country for the people who have very, very low opportunities. So it's more a romantic thing to say, but I wanted to have the best education, to share that with the people in this country, and I think I have done it. And I can say that I am successful in bringing the best experiences in the country, in the world, to my country.
I didn't make him say that, by the way. That was perfect.
He was pinching me.
You redeemed yourself from your opening statement. Okay. Other questions? Did that answer your question? Okay.
What kind of relevant work experience is advised to have for the Doctor of Philosophy degree? For example, the biological sciences and public health. Is it enough to have undergraduate work experience on internships, for example, or do you need to have something graduate work in order to make the admission easier, to say?
So if you don't have any graduate work and just a bachelor's degree, do you have a bachelor's degree in?
I have it, but it's not relevant.
Okay. Is it in sciences, chemistry, biology?
Food and beverage.
In,
But I have an internship in research that is very relevant for that. But that was undergraduate internship.
okay. So speaking in the abstract is a little difficult. Maybe we should talk afterwards. I'm going to say if you don't have a bachelor's degree in some sort of science background, plus a little bit of research work
And the
experience.
bachelor is in nutrition.
The baccalaureate's in nutrition.
And my work experience is food and beverage.
Let's talk afterwards. Let's take that because I think typically to get into the PhD program, they're going to want to actually see a very strong application based on what are your research interests, what is the prior research that you've done, and again, it may be at the baccalaureate level, or it may be in a sort of an internship position post baccalaureate in that year after your bachelor's degree or something. But I think they're going to want to see that you have a defined set of questions that you want to answer. Again, sometimes those questions are policy questions, sometimes they're biological questions, but they want to see that you have some sort of interest in something that you want to explore. So I'm going to be honest, it sounds like you may be in a little bit of a difficult position for that particular degree program without getting some other experience or some graduate level work under your belt.
The question was also in order to know if it was better to apply for 2017 or 2018, for example, after having some more real-time experience.
Given what you just said to me, I would say probably not before 2018. Again, I don't have a whole lot of information, and you may want to address some of those questions directly to the admissions office as well. Okay, sure. Anybody else? Yes.
Sí.
La diferencia aquí para ti estudiar en Harvard, por ejemplo, en alguna otra universidad, de experiencia, de no sé, los ideales, valores que toman la universidad y cómo hacer su trabajo actual. Y ahora aquí en México, la segunda sería si hubo alguna otra buena fiesta.
¿Sí hubo qué, perdón?
¿Alguna otra buena fiesta después que te perdiste? Y después hubo buenas fiestas.
Mira, la verdad es que entrar a Harvard me parece que son varios caminos en paralelo. Uno de ellos es estudiar mucho. Les platicaba en el buzón, el primer día era un mamotreto de este tamaño. Hay quienes no lo estudian, hay quienes copian en Harvard. Pero hay quienes no estudian, hay quienes sí nos encanta leer. Y te pones a leer y leer y leer y aprendes. Y además los profesores son muy abiertos. Y entonces tú sacas una cita con ellos y puedes platicar del mismo tema que estuvieron dando la clase y te profundiza y te aclara tus ideas. No hay forma de graduarte si no estudias. Pero en paralelo es tanta la presión que también hay muchas actividades sociales. Fiestas. Enfrente, right across the street, is the Squealing Pig. Es un bar que...
Do you know what to translate that into Spanish for them? Cochon,
Sí.
the cochon qui...
oh,
that's French, sorry.
Es el grito del puerco, el quejido del puerco, si quiere llamarlo. Squealing es como... Entonces, pero es un bar que está enfrente. Que
It's a place to drink beer.
Ajá, pero todos los viernes se juntan todos los estudiantes ahí, muchos estudiantes ahí. Pero como eso hay muchas fiestas, eventos sociales, para un poco llevar esa tensión y esa presión, pero tú ves sábados, domingos a los chavos estudiando en las computadoras, etcétera. Pero eso tampoco quiero que se espante porque es la forma como te envuelven y te motivan y te promueven a seguir aprendiendo más. No es pasar el examen, es aprender y regresar. con ese aprendizaje sólido. Me acuerdo mucho la clase de epidemiología 2, éramos un salón de 110 personas, 110 alumnos, un auditorio muy grande. Y la profesora, además de que era el libro, uno de los grandes libros, digamos, que se utilizan en el mundo, ella era la que lo había escrito. No sabes qué curso tan fascinante, no es broma, al final del curso era, sí, ovación de pie a la maestra por 5 o 6 minutos. Es cuando entras ahí, and I want to say this in English because I want to be very sure that you get it.
Okay.
What I want to say is Harvard, it is the best school for me. What I want to say is it could be a little polemic saying, well, maybe it's not, maybe it is, maybe MIT is better, maybe another school is better. But for me, when I chose to go to Harvard, it was the best school for me. And I'm sure it's still the best school for me. End of the quote. Pero lo que sí es que logras tener una inmensa comunicación con alumnos de otros países. Tenía yo un compañero que era indio Sioux y él estaba en el PhD y su idea era cómo la medicina alternativa de su comunidad, de los indios Sioux, se podía aplicar a la ciencia. Y ese fue el desarrollo de su doctorado, un poco por lo que tú decías, pues qué es lo que yo quiero, ¿no? Y algo tan sencillo al parecer, pues lo hizo todo un desarrollo de un programa doctoral. Y quizás lo que decía Patti es bien importante, no se detengan por la parte económica. Yo no fui con beca porque cuando estuve 3 años antes, como estuve 3 años trabajando, junté dinero para el primer año. En el tercer semestre, como me fui a Suecia, no pagué colegiatura y me pagaron en Suecia. Trabajé en el National Institute for Working Life, se llama, Arbetsliv Institutet en sueco, y pude juntar para el 4º semestre. Entonces, la verdad es que si tú no tienes la posibilidad, ellos te la encuentran. Lo que necesitan es gente que quiera hacerlo. Cuando estaba yo en el 2º semestre, inicié un programa con la Universidad de Nuevo León, una Universidad Autónoma de Nuevo León. Había 10 becas compartidas entre Harvard y la Universidad de Nuevo León. Se inscribieron 2 estudiantes y ninguno de los 2 terminó. Eso fue bien triste porque al siguiente año ya no había estudiantes. Y a mí me preguntaban, ¿quieres entrar a esa maestría? Le dije, no, pues yo estoy acabando, ya me voy a regresar. Pero decían, es que nos cuesta mucho trabajo creer que todo el soporte económico para estudiantes y no lo tomen. Entonces, me parece que es el que quiera estar ahí y tienes que tener muchas ganas porque si dejas familia, pero te enamoras de la ciudad. Aparte, Boston is so beautiful that you really get in love, fall in love. Te enamoras de la ciudad, le tienes que ir a los Red Sox porque yo iba a los Yankees y sí era un tema.
Don't even.
No, that's what I said. I'm supporting
The Red Sox just
yeah.
lost last night.
That's right.
They're out of the series.
Pero me parece que es las ganas que tengas lo que te va a llevar a terminar una maestría y realmente aprender.
Yeah, I caught some of that. Boston's an amazing city. It's an amazing city for many reasons. I moved there when I graduated from my undergraduate degree 29 years ago. And I fell in love with the city. I fell in love because it's really a hotbed of intellectual activity. And whether or not Harvard is the best university in the world, we like to say that, of course, because that's our job. But certainly within a few miles, there's more intellectual activity and more universities than any place else on the planet. And that's an incredibly rich environment to be a student in. And whether you're meeting somebody at the Squealing Pig, or whether it's at some other place, it really is an enriching place to be. It's an incredible walk. It's a great walking city. We're very proud that we're called America's Walking City. So if you're a public health person, get out and walk. Traffic is terrible, so walk, walk, walk. But it's a beautiful city, and this is the most perfect time of year. Fall, October in Boston, everything is pink and red and orange, and I can't tell you how much I fell in love with Boston. So hopefully you'll like it too. And we're at sea level. So those of you who are used to living at 6,000 feet may enjoy living at sea level on the ocean. So, any other questions about academics or life in Boston or anything else?
Question. What if I was to get in the 65 credit MBA program? I have a medical degree, but I don't have any relevant work experience. Can I get it, or I need the degree?
So, if I understand correctly, Mexico, you have a 6-year degree.
Yeah.
Is that correct?
Yeah.
And have you done any residency post medical?
No.
I always have a little bit of a difficulty in translating the medical degrees in international into our setting at home. And so I would say that you would want to address that question to the MPH program directly, and I can give you their contact information. Also, because the MPH 65 is new, we've only enrolled our first set of students this fall. So I'm a little less familiar with the shifting requirements there. So there's 2 compounding factors there. One is the program's new, and the 6-year program versus how that gets translated into whether or not they consider you having essentially a bachelor's and a master's degree. That may very well be the case, in which case they might let you into the 9-month. It sounds to me like you might be a candidate for the 65, the 1.5-year program, though. Yeah.
Roughly how many hours per day do you work?
Nowadays?
No.
In Boston.
Per day.
Today a lot. Well, I have a kind of combination of both because since I need the money, I worked 3 years before. Then during my master's degree, I still working. I still doing some research in ergonomics now and human factors, which is it seems that ergonomics is all the musculoskeletal disorders and human factors is more like the brain and stuff like that. So I was working at the Harvard Occupational Biomechanics Laboratory, and then I still making some money for my living expenses. So, but I could say I never went to bed before 1:30, and I got up around 7 or 6:30 or so. But you have so much fun. I mean, even the classes are so cool.
I'll mention one other thing that people may not be aware of, and it's called OPT. It's optional practical training. So if you come to the U.S. as an international student on a student visa, and you earn a master's or a doctoral degree in what we refer to as STEM, science, technology, engineering, and mathematics, you have the option to continue on that visa under the OPT provision, the optional practical training, for an additional year. That was recently extended for folks in STEM to 2 years. So there's an opportunity once you earn that degree in the United States to gain an additional 2 years of training in the United States without having to worry about having a permanent citizenship or a green card. Employers can hire you legally, and you can work for them for 2 years before having to return to Mexico. Sometimes it leads to a sponsorship and a job. More often it doesn't, but it can actually be valuable post-graduate training experience at some of those institutions right in our neighborhood, for example, before bringing those additional skill sets home to Mexico. I'm sorry, follow a
limit.
a limit.
Like you said, with your resume, 1 page, 2 pages, pretty much sure. The second one is how can I get in contact with the alumni network? And the third one is there some kind of normal age to apply to a master's degree or a PhD?
I'll take the last one first. The answer is no. I would say that folks going into our PhD program tend to be somewhat younger than some of our other programs. For example, the Master of Public Health will find folks often returning mid-career to add a skill set. So, for example, clinicians may decide 10 or 15 years into practice that they need to add management skills. They've been promoted to supervising, for example, an emergency room or a surgical unit, and they realize they don't have the management skills to actually keep up. They were trained very solidly in their clinical skills, so they'll come back and get a master's degree in either management or clinical effectiveness. Those students may be in their 40s. The PhD students tend to have a couple of years of work experience, so they may be in their mid-20s to late 20s when they enter a PhD program. You'll find many PhD programs where folks come right out of undergraduate. That almost never happens at our school. So I would say if you finish your bachelor's degree and you're 21, 22, you have a couple of years of work experience, you're 23, 24, so the age might be around 25, but there is no, in the United States, it's illegal to have age limits for anything. So we have minimum entry requirements, but there aren't age requirements, either on the top or the bottom end. We require you to have certain experiences before you get into the program. That was the third question. The first question was the
limit of the statement.
Of
How
the-
many pages do you need to
Yeah,
write?
I would suggest that 1 to 2 pages is sufficient for the personal statement. Anything longer than that, and you might want to think about whether you're using too many words. Maybe you're using the Mexican
Style.
circular argument and not actually getting to the point. Okay.
And the other one was how can I get in contact with the alumni network?
Yes. So you can email me. We have a number of folks here who are quite active in the alumni network. Santiago is one. Unfortunately, he didn't make it. Martin Lajou, who is at the INSP. He has 3 Harvard. He has a master's degree, a doctoral degree, and he was also a postdoctoral fellow. And he continues to hold a research appointment there at the school. But he's here he's a nutrition scientist in Mexico. So he's quite a good resource, as well as some of the other folks who've been panelists today that I can put you in touch with. So, and you can also reach out to the Fundación because they have a list of volunteers that are willing to talk with you folks. And that was the email. I think Patty gave you her contact information earlier.
That's the last question.
Rosaria.
I'm a little shy because I'm the oldest, and this question is very particular for me. I have 2 dependents on me, and that are my daughter and my wife. So, what happened there? There are possibilities to go there.
I don't know the answer to that question, so I'm not even going to try to answer it. I would suggest that you address that to our admissions office, who can either answer it for you or put you in touch with we have a very, very strong international office that deals with students and all the issues around visas coming to the U.S. and what the rules and regulations are. So I'm not even going to attempt. And you shouldn't be shy about being the oldest student because I guarantee you I'm the oldest one in the room. I did the math. I'm older than you.
Okay.
I counted from 32 at 2001. I'm older than you are.
Okay. I know some people that went to the master's program or PhD program with their entire family, like the wife and the kids and everybody.
Yeah, I'm pretty certain that immediate family, so wife and kids, it's unclear to me whether a dependent parent, for example, falls under those. So I don't want to attempt to steer you in the wrong direction. Immigration in the United States, as you may know, is a bit of a hot button topic at the moment. So I need a pin that says no wall. Just so you know. And if there is one, I will bring you all rope and I'll help you climb the wall to get to Harvard. Don't worry about that. Any other questions?
Perdón, incluso hay un caso, Leonora Rojas, que estaba estudiando su doctorado y tuvo a su bebé. Se llevó a su nana, a una persona que les ayudaba y está como eslabonada, como linkeada a tu visa y tú respondes por esa persona. Y la señora les cuidaba al bebé porque los dos estaban estudiando.
Yeah, and because our students are a lot older, we often have families there. We have people who have children while they're at school. You know, I think Marcela Tamayo, who was a panelist earlier today, I think she got pregnant and had her child while she was a doctoral student at the school. So imagine that. And she had her husband with her. We even have some housing it used to be called Shattuck International House. Now we just call it Shattuck House. And it was originally intended for folks coming from out of the country, and there's multi-bedroom units in there for folks who are bringing their kids and so because our students are not necessarily a traditional age all the time. So you should not at all be embarrassed. There's many, you'll find many students your age at our school.
Una pregunta para Antonio. Específicamente estaba hablando de las visas. ¿Cómo, o sea, tú que estuviste ahí tanto tiempo, qué tipo de visa conseguiste?
Me invitaron a quedarme a trabajar con ellos. Y entonces me dieron la J1, allá le llaman The Junk One, porque dicen que es la basura y que rápido la tienes que regresar. Pero bueno, esa visa la tienes que renovar cada año. Y cada año me la renovaron durante 3 años. Cuando ya entré a la maestría, ya me dieron la visa de estudiante. Y con esa visa estás mientras dure tu educación, tu programa. Pero nunca tuve problemas ni para recibir dinero, ni para nada. Porque incluso tuve, perdón, eso me faltó, de la Fundación México en Harvard también recibí al año como $13,000. Entonces la verdad es que regresé sin deudas y sin dinero, pero no le debía yo a nadie, que también es, cuando regresas a empezar, es muy importante.
Desde tu experiencia, ¿qué es lo ideal? ¿Iniciar este programa, concluir la carrera o cuando ya tienes algo avanzado? En un caso personal, hago el servicio social en medicina y me interesa mucho porque soy fanático de la salud pública. Sin embargo, pues tengo la oportunidad de hacer la especialidad. Entonces, desde tu perspectiva o desde tu experiencia, ¿qué es más recomendable? ¿Terminar lo que pues, es tu línea o a concluir los estudios universitarios y irte a este programa?
Mira, yo lo que diría, y que fue mi experiencia y creo que fue lo correcto, es trabajar un poco, encontrar qué es lo que quieres hacer en tu vida y entonces ya decidir a qué programa te vas. La verdad es que lo que te puede compartir Harvard y lo que tú puedes entregar a Harvard también es muy importante. Entonces, si acabando la carrera vas y te aceptan, qué bueno, porque vas a tener posibilidad de estar más tiempo, vamos. Pero me parece que también que tú puedas, lo que hace rico a Harvard es todas las experiencias de todos los alumnos del mundo. Entonces, que tú también puedas compartir esa experiencia no es la misma que la teoría de la escuela, sino que sepas qué está sucediendo en tu país y cuáles son las debilidades y las fortalezas de tu país. Es lo que la gente de Nigeria se va a llevar, la gente de Singapur, la gente de Taiwán. O sea, Seguro Popular hace un programa que mundialmente ha sido reconocido por el Dr. Frank. Y que yo creo que mucho fue su experiencia que compartió en Boston y que ayudó a mucha gente. Entonces, desde mi punto de vista es tener algo de experiencia y entonces ya vas a encontrar qué es lo que quieres hacer más adelante y hacia dónde quieres. Si tu pretensión es regresar a México a trabajar acá, ya sabes en qué te tienes que enfocar y ya sabes a dónde vas a regresar a México y en qué vas a trabajar. Sí.
Last question? Great. Well, I want to thank CIDE and all of you for coming out tonight, and please join me especially in thanking Antonio, who, as you can imagine, has an incredibly busy life, for taking his time to share his experiences. I think it's a testament. Antonio is typical of the kind of alumni we have at the school, who are always willing to reach out and give a hand. And so, please join me in thanking Antonio for being here today.
Gracias. Thank you very much.
I'll be around for a while if anybody has individual questions. I have another thought for you, by the way, a follow-up to our earlier conversation. If you want to just, you know what, leave all of those little forms on the back corner there, and I will pick them up on the way out. That way everybody can just leave them on your way out the door.